The other big news of the day, plans are progressing smoothly for the completion of the new that's the new National Hospital. That was the update provided by the Ministry of Health on the project. Once completed, Lucians are being told that they will have access to one medical complex that will encompass a range of services. The health minister says the new general hospital is one component of a broader plan to transform the healthcare sector. Construction on the general hospital is scheduled to be completed by December 31st, 2012. The process of commissioning will then begin over a 6-month period before being operationalized.
The commissioning process will include activities such as equipping, outfitting of kitchen and laundry, signage, among others. Our new National Hospital will comprise the following: a 116-bed facility providing all the services currently being provided at Victoria Hospital. In addition, it will provide an increase in services including improved diagnostic services such as CT scan and MRI, as well as day surgeries.
Authorities are excited about being able to offer a range of services all in this one medical complex, including the services of the Mental Wellness Center and the Turning Point Drug Rehabilitation Center. A board of directors will be instituted and decide on the management structure of the facility. Already, the returning 125 nursing students from Cuba present government with a ready talent pool to deploy. The chief medical officer, however, says training of medical professionals has been taking place across the board.
And very soon we'll be instituting the component that deals with the training of the, biomedical technicians, those involved in operating the instruments that will be coming in. Because as Minister indicated, the new National Hospital, we will be having additional diagnostic services such as CT scans and MRI. So right now we are working towards identifying the persons that we have within the Victoria Hospital right now, within our health facilities, as well as bringing in some new persons to be trained in maintaining and taking care of the equipment that will be coming along with the new National Hospital.
While all these changes are taking place against the backdrop of improved services to the public, what of the cost to be met by the public? Already, operational costs at Victoria Hospital runs in the region of $12 million annually. Officials say projections put operating the new medical complex at twice that amount, with a revision exercise underway. The permanent secretary says there will be a general review of costs associated with healthcare financing, delivery, consulting physicians and providers.
We will be extending the consultation to the public in terms of the specific policies that will go behind those costs, but just by examining the sheer number of initiatives that come as a result of not only this project, the cost associated with that will necessarily be increased. Within the policy as well, the universal healthcare policy, the idea is that a specific basket of services will be available to the public, much of which is quite available in its present form.
A rush has been placed on the construction given the time lost as a result of a slowdown in works earlier this year. The chief health planner says all issues have been resolved and contractors have recommitted to the project. The ministry and the contractors were at odds over many matters. The contractors wanted an increase, arguing increased cost in raw materials.
But they have signed a written agreement with to that respect. So yes, there have been a period of delay as a result of the slowdown, but as I indicated, they've committed to completing the project by the 1st of December. And as a contractor, they would be well aware as to what they need to do to meet that timeline.
What has to be done is the internal fit-out in terms of walls, flooring, lighting and the like. And as I say, we're about 85% through that. And the external works, well, they're subject to the weather. As everybody knows, we're in the rainy season, and God willing, with a fair wind, we will finish those as well. But from my perspective, if the weather changes, it delays that. It doesn't actually delay the building. So the next exercise and this project is to do the furniture and equipment fit out.